Good morning and welcome to Radio Friends on Friday, March 20th. My good friend Anand Chockalingam, Dr. Anand Chockalingam, is with us. Good to have you here again, Doctor.
As always, a pleasure
Yes,
to be on your show,
all right.
Paul.
Our expert heart doctor. And today we are going to talk about stress-induced cardiomyopathy.
Yeah.
Right? What is that?
It's called Takotsubo cardiomyopathy, broken heart syndrome, apical ballooning syndrome. But the commonest way people look at it right now is stress cardiomyopathy. When I went to medical school 20 years ago, we didn't even know this condition existed.
That stress
Yes.
cardiomyopathy.
So we thought it was a heart attack. Even today, many of these conditions, people think of it as a heart attack because they develop acute chest pain, the heart is weaker, there is risk for life, it feels like a cardiac emergency. And even cardiologists, without doing the appropriate testing, we cannot say for sure what is going on with the patient. So for all practical purposes, this is very, very similar to a true acute heart attack.
But it's brought on by stress?
That's the challenge. It is.
It's brought on by stress.
Stress. The word stress can mean mental stress half the time. Half the time it is physical stress, like being in a motor vehicle accident or having severe sepsis or being through a 6-hour major surgery. Many things, or having burn injury. Many physical illnesses can also be the stress.
And you're saying the stress can mock a heart attack?
So what I'm saying is mental stress, like losing a dear one, going through a divorce, losing a job, or sudden emotional stress within a couple of hours can manifest very similar to a heart attack. And it happens way too often. In the last 10 years, I've seen, I would say, several hundred patients myself.
So how do you determine that it's not really a heart attack, but it's stress that's causing it?
As I said, ECG may look like a heart attack. The blood tests look like a heart attack initially. Even the ultrasound we do on the heart may show the heart is really weak when the patient is coming in with chest pain. So we have to take them to the heart cath lab a lot of times and do the angiogram and look at all the blood supply to the heart. And if that looks completely normal, then we look back at the heart patterns of being weak and then determine, yes, this is not a real heart attack. This is in fact only stress cardiomyopathy.
Wow.
So it's pretty involved. It cannot be easily distinguished at
Exactly.
this time.
So how do we avoid causing a situation like that?
We all need to take life very easy. Much easier said than done.
Yes,
so
it is.
In
And we all
real
need
life, it is not that easy to give up mental stress because it's part and parcel of life.
Well, the first time I met you, you said you got to smile, what was it, 10 times every half hour?
Yeah, 20 times an hour. You got
20
the
times
numbers right.
smile, 20 times an hour. And I don't want to get off the subject, but I just read a story a couple of days ago that the oldest living man, who was 112 years old, died just recently, and he credited his longevity to smiling.
Wow.
He said people would ask him, why are you living so long? He said, because I smile all the time. As soon as I read that, I thought of my friend, Dr. Anand Chockalingam, who says, smile 20 times an hour.
So now everyone listening to your show today now has a chance to live to 112 just through smiling.
If you smile. And even if you're not happy, if you go ahead and smile, it does something to the body, doesn't it?
It does, but preferably be happy also inside. That will be a whole lot better.
Okay. Now you're doing a seminar.
Program for this. You were asking how to avoid the stress cardiomyopathy. A couple more things I wanted to tell about this. Unfortunately, women are 9 times more at risk for this than men, and it most often affects women about the age of 50 to 80 years of age. That's the commonest age we see.
50 to 80.
And men also we see many men with this problem. So mental stress can cause acute heart weakening, stress cardiomyopathy, and there is a close to 5% mortality with this problem. So it's not a benign issue.
Okay.
But if we support it, within a couple of weeks, the heart completely recovers. So after that, their heart is totally healthy if we identify it and take care of it at the early stage. So
Now,
I was going to tell you about how to avoid this.
You're doing this. You're doing this program.
Yes.
It's called Heartfelt Living.
Heartful living.
Heartful Living.
Yeah.
And it's free of charge.
Yeah.
And I'm going to say, and you're doing it just on your own time. You're not charging to do this.
Thanks to the help from the whole health group at the VA hospital in Colombia, I've been doing it now for close to 5 years.
So you're just donating your time and doing it, and people can come in, and it's free of charge. It's at 12:30 every Friday?
Most Fridays of the year we have it, but it goes in 8-week cycles. So it's 8 sessions. For 30 minutes, we discuss various issues. 15 minutes, we answer all the questions. And then 15 minutes, the last 15 minutes, we practice several different mindfulness methods. So
Like
that
what?
people can become more aware of their own understanding of themselves, the inner journey, so that they can cope with life's challenges better. They are better equipped to deal with life.
Can you
itself.
give us one? We've got just a little bit of time left here. Can you give us one exercise that you would do?
One is silence.
Just
the
silent.
other thing is being mindful about eating, then practicing mindfulness during day-to-day activities, being more self-aware during work, participating in more mindful exercises. So we teach so many different things.
Yeah. The first thing you mentioned was silence.
We talked about it on another
silence.
show. Yeah,
Silence.
One easy
how
step
often
to,
and how long should we be silent?
Yeah, maybe if we can do 10 minutes every day, that's beautiful. If we can stay quiet for 10 minutes and think about some pleasant thoughts, we can avoid this stress cardiomyopathy, and we can avoid heart attacks too.
Okay. All right. Well, this program's about 10 minutes long, so we could just start this program sometime and say we're going to be quiet for 10 minutes.
Yeah, let's
I don't
do
think
that.
that'd go over very well, but you try it at home. Try it at home. Just sit quietly for 10 minutes. And that means no talking. That means not checking the phone.
Thoughts will come.
Thoughts will come.
Look at the thoughts, feel what you are relaxing about, and then let the thoughts just disappear.
Okay.
Then try to bring your mind back to your breath. That's all you need to do.
To your breath and your breathing.
Yeah.
All right. If people want more information, well, I'm going to give the phone number for this for the Heartfelt
Anybody
Living.
is welcome to sign up. It's free. Fridays from 12:30 to 1:30, we have a beautiful center at the VA hospital.
At the VA hospital.
And we've opened it up for the public here.
Okay, it's free of charge, but call 814-6273. Tell them you heard about it on Radio Friends. You want to sign up. It's free of charge. It's every Friday, 12:30 to 1:30 at the VA hospital. Heartful Living, and it's presided over by Dr. Anand Chockalingam, who's just donating your time to that too. Doctor, thank you so much for coming by.
Thanks. So
Always
much
a
for
pleasure to
having
have you here.
Thank you.
Okay, we're out of time. See you next time. Bye bye.